Good morning, everyone. Welcome into North Dakota today. Right now, we're taking a minute to talk about our health. Every 40 seconds, someone in the U.S. experiences a stroke. May marks the American Stroke Month, and now it's time to educate people about the signs of a stroke and encourage you at home to take action to prevent stroke. Joining us this morning is Sanford Health Medical Director of the Stroke Program, Dr. Mike Manchak. Good morning.
Good morning. Thanks for having me.
Yeah, thank you for being here. A very important month and a very important topic. You know, just to kick things off medically, what would you describe as a stroke?
A stroke happens when there's impairment of blood flow to one or more parts of the brain. And if those parts of the brain don't get the blood, they don't get oxygen, they don't get nutrients, the cells in the brain die off, and then that manifests itself as various symptoms of a stroke and various deficits, neurologic deficits that people will have.
Now, are there technically two different types of strokes that people can go through?
Yeah, there's two big types. Most strokes, about 85% of them are what we call ischemic strokes. And that's when an artery actually gets blocked. It either gets blocked with a blood clot or because the artery is diseased, the artery itself will close down. The other type of stroke, hemorrhagic stroke, is the other 15% or so. And that's when the artery actually opens up and leaks blood into the brain.
Wow. So are there different types of warning signs or symptoms for each, or is it generally the same?
So it is generally the same. Okay. It just depends upon not getting blood flow to a certain part of the brain, and whether that's because the blood is leaking out of the vessel and just not getting to that part of the brain, or because that artery is blocked. But because it's the same part of the brain not getting the blood flow, the symptoms would be the same.
It just sounds so scary, and really timing is everything. That's what people always say. Timing
Absolutely.
Is the most important.
Absolutely.
So what are the big signs and symptoms? Because they really come on without a lot of warning.
They come on without a lot of warning. They come on suddenly. That's sort of the hallmark of a stroke. We try and tell people to remember to be fast. That's the acronym that we're using.
Yeah.
So the B stands for balance. So if suddenly you feel very off balance, you're staggering around, trouble walking. The E is for eye, anything with your vision. Loss of vision, double vision, blurry vision. The F really means face, so we're looking for some sort of drooping down on one side of your face. The A is for arm, so weakness in your arm, and that goes for leg too, but we use the A because it spells everything out nicely. The S is for speech, so slurred speech, or really any trouble with your language, getting words out or having trouble understanding when people are talking to you. And then T is time. The most important part of this whole thing is time to call 911. You need to call 911 as soon as these are recognized in yourself, in a loved one, in somebody in the grocery store.
Yeah, unfortunately, you know, these things come on so quickly, and sometimes you're unsure if it is a medical emergency or if maybe you have low blood sugar or something casual. What do you suggest if you even suspect any type of stroke symptom? Are we calling 911 immediately? Are we going to urgent care? What do you suggest?
I would always suggest to call 911.
Okay.
And what people need to understand is the reasons to call 911 as opposed to trying to drive yourself or trying to drive your friend or loved one or going to the urgent care or an emergency room yourself. These EMS professionals, they know what they're doing. They can spot the signs of strokes. They have medicines in their ambulances that can start to treat the stroke as they're on their way to the hospital. They have the availability to communicate with the hospital about things like your medical history and when the symptoms came on. These are vital pieces of information for the stroke neurologists and the emergency room doctors to know. And so I always recommend please just call 911 and have those professionals bring you in, because they can also let us know ahead of time. And we have a whole protocol in place where if we know that they're coming, we know exactly how to handle it once they hit our door. The crucial part is recognizing things quickly and making that phone call so that you come to our door as fast as possible.
Okay, and I've always wondered this question. Should someone take an aspirin if they think they're having a stroke, or is that kind of an old wives' tale?
I wouldn't necessarily think of it as an old wives' tale. I think what happens is people think that strokes are exactly the same as heart attacks, and because you have that 15% that are hemorrhagic strokes, If you take a blood thinner, which is what an aspirin is,
Yeah.
you can make that type of stroke worse. And we don't know what type you have because, again, the symptoms are the same until you get to an emergency room and we can get a CAT scan, a picture of your brain.
Okay, wow, important to call 911 and seek professional help. Thank you so much for all of this information this morning.
Absolutely. Thank you for having me.
Yeah, of course. All right, everybody, stick around. We have plenty more coming up right here in North Dakota Today.